Welcome to Dr. Balga's podcast for the Curious Doc. Today is February 15, 2026. This video is on a Nature article published 4 days ago, 11th February, titled Targeting Excessive Cholesterol Deposition Alleviates Secondary Lymphedema. Lymphedema is a chronic disease of impaired lymphatic drainage characterized by tissue swelling, adipose tissue expansion, inflammation, and fibrosis. Lymphatic vessels transport cholesterol from peripheral tissues. Impaired drainage leads to excessive tissue cholesterol accumulation. So the hypothesis for the study was defective cholesterol clearance contributes to dermal adipose tissue remodeling and disease progression. So they had a human study and a mouse study. In the human study, full thickness skin biopsies and plasma from healthy controls, 67 individuals. And secondary lymphedema stage 2, 9 to 10 individuals, and stage 2B or stage 3, 4 to 5, all female, non-obese. The mouse model was ApoE knockout mice, hypercholesterolemic mice, and surgically induced lymphedema. Interventions included cyclodextrin and HDL ApoA1 interventions. Histology was determined by hepatoxylin eosin, Picroceros red, and Philippine staining. And gene expression, PPARG, FABP4, ADIPOQ, LEP, relative to GAPDH were assessed. Statistics included Matt-Whitney U-test, one-way non-parametric ANOVA with Dunn's correction, home method for family-wise error control. What did they find? Hypertrophy of the adipocyte increased in stage 2 lymphedema, p-value 0.0004. Adipocyte density reduced in stage 2b, stage 3, p-value equals 0.0059. Dermal collagen increased, p-value 0.016. Dermal adipose tissue collagen increased, p-value equals 0.006. Free cholesterol deposition increased in the dermis, p equals 0.042, and dermal adipose tissue increased, p-value equals 0.0004. Mass spectrometry confirmed increased free cholesterol, p-value equals 0.0411. Post-surgical lymphatic venous anastomosis reduced dermal free cholesterol. The p-value was significant at 0.0429, and the dermal adipose free cholesterol was reduced, a p-value equal to 0.0392. Cyclodextrin reduced tissue cholesterol and swelling in mouse models. Example, skin-free cholesterol, the p-value for which was 0.0286. What were the limitations of the study? Small human sample sizes, cross-sectional human data, stage 3 tissue remodeling, limited compartmental quantification, and mouse models may not fully replicate human normocholesterolemic state. The key takeaways was tissue cholesterol accumulation is central to the pathophysiology of lymphedema. Cholesterol depletion restores lymphatic architecture and function. Cholesterol clearance represents a novel therapeutic strategy. There was an accompanying News and Views article in the same issue of Nature on this article, titled Clearing Trapped Cholesterol Could Relieve Lymphedema. This News and Views article says, lymphedema is driven not only by fluid stasis but by local cholesterol congestion in peripheral tissues. Impaired lymphatic drainage leads to dermal adipocyte hypertrophy, macrophage infiltration, fibrosis, and free cholesterol deposition, despite normal plasma cholesterol levels. Human surgical restoration of lymphatic flow reduces tissue cholesterol and partially normalizes adipose architecture. In mouse models, cholesterol-clearing agents, including HDL, lipoprotein A1, and cyclodextrin, reduce swelling and promote lymphangiogenesis via VEGF-C signaling. The conceptual advance is lymphatic failure leads to lipid retention, which in turn leads to tissue remodeling. The therapeutic implication is target tissue cholesterol to restore lymphatic function. Go ahead and read these two superb articles in Nature from this week. Clinical pearls. Excess dermal cholesterol occurs despite normal plasma cholesterol levels. Dermal adipose tissue remodeling resembles obesity-associated hypertrophy. Foam cells appear in advanced disease stages. Surgical restoration of lymphatic drainage reduces tissue cholesterol. Cyclodextrin promotes lymphatic regeneration via vascular endothelial growth factor C signaling. These are some eponyms related to lymphedema. Hit pause and read at your own leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.